Communication is the cornerstone of human experience, but for thousands of people suffering from disorders such as amyotrophic lateral sclerosis, ALS, or captivity syndrome, this capacity is drastically reduced. Until recently, the most effective solution to return their voice was the implantation of intracranial chips, an invasive technique that carries surgical risks and long-term complications. If you like this content, do not forget to subscribe to the channel and like the video. Here we explore the latest advances in technology and health, so make sure you don't miss anything. However, a series of disruptive research led by Meta AI and the Chinese Academy of Sciences published in journals such as the Innovation Informatics mark a significant advance in the scalability of non-invasive interfaces. By using a technique called magnetoencephalography, MEG, along with language models, scientists have been able to read your thoughts accurately. This advance allows for the reconstruction of continuous phrases from brain activity without touching a single nerve. This is a fundamental step to help reduce the need for invasive surgeries in the future of rehabilitative medicine. To understand how a machine can interpret what happens inside the skull, we must observe the physics that governs our neurons. Every time we think of a word, thousands of neurons shoot in unison, generating magnetic fields that the MEG can capture. The historical problem of this technique was noise. The signal is so weak that separating the message from the rest of brain activity was like hearing a whisper in the middle of a football stadium. This is where semantic reconstruction of speech comes into play. The new models developed by Meta AI use an artificial intelligence architecture known as transformer. These algorithms have been trained to understand the context and probability of words, allowing to reconstruct complex phrases with amazing coherence. One of the most rigorous points of research is the identification of the hierarchy of neural dynamics. Researchers found that the brain does not process language flatly. There is a clear structure that distinguishes between the intention to communicate and the specific content of the message. Through the use of advanced models, scientists have been able to guide decoding using information obtained by functional magnetic resonance. This has allowed technology to learn to separate the noise from the true linguistic signal. The great advantage of this approach to projects such as Neuralink is the absence of surgery. A device that is placed like a helmet is much easier to upgrade and repair than an implant that requires drilling the bone. Despite the advances, we must maintain a balanced view of the current state of technology. Although we can talk about a successful decoding, we are not yet at the point of a real-time conversation at natural speed. The fact that an AI can read your thoughts opens a debate about mental privacy. We face unprecedented ethical challenges, although current systems require voluntary user cooperation.